Well, I'm certainly honored to be here and presenting this evening. I present dozens of times through the course of the year, and it is always an honor and a pleasure to be here and to elaborate in greater detail on the importance of fat cells and adipocytes, as they're referred to, and adipose tissue, and its important link in endocrinological diseases and cardiovascular disease, and the struggle that we have to effectively treat obesity and overweight individuals today in North America and really throughout the world, and what types of interventions are there, and how can we effectively hamper or slow this epidemic that's facing many, many different nations. So I'm one of the co-developers of Zerona. It has been a passion of mine for the past 9 years now. The first Zerona patient ever to be treated was my college roommate nearly 8.5 years ago, treating his pseudogynecomastia, seeing a fantastic reduction, restoring his confidence. The evolution of Zerona and what we have been able to accomplish, achieving first milestones through the FDA and Health Canada, achieving over 20 peer-reviewed publications, is a testament to our commitment to evidence-based medicine, to demonstrating the importance and clinical utility of this technology. So let's first begin with the tissue that we're treating and to understand in great detail the importance of this tissue. A majority of disorders and conditions that plague North America are actually preventable chronic diseases. And they stem, as new research shows, from the enlargement of adipose tissue. A lot of people view the fat cell, the adipocyte, as simply a cosmetic type tissue cell. It really doesn't serve much biological function in the body. It's garbage can, if you will, of the body that stores excess nutrition. And we just exercise and work out and we can deplete it of its stored material. But over the past decade, more and more research has been able to elucidate or demonstrate the endocrine function of adipose tissue. In fact, it has been recognized as an endocrine organ. It is responsible for releasing hormones known as adipokines that regulate insulin sensitivity, glucose metabolism, beta oxidation, hunger. And what we find and observe is that when this tissue becomes enlarged based on the excessive accumulation of lipid material, we see a tremendous deterioration in its biological function. Beneficial adipokines or hormones such as adiponectin or leptin are severely altered. We start to see a rise in noxious hormones such as resistant, pro-inflammatory cytokines, and that leads to an acute and then systemic inflammatory event. This leads to insulin resistance and other comorbidities associated with the expansive outcome of the adipocyte. So what we see is that because this cell accumulates and its function is drastically altered, there's the manifestation of other conditions and disorders, these comorbidities. And so we try to go to specific mechanisms to alter cholesterol levels through pharmacological agents. We attempt through other strategies to thwart or hamper the progression of some of these conditions. But still, at the core of the complication is still the hypertrophic or enlarged adipocyte. So we make basic recommendations to diet and exercise to support the pharmacological intervention. But that now relies on the person's commitment. Can they remain steadfast to the dietary regimen? Are they capable of committing themselves to dietary restrictions and engaging in extensive physical activity to increase their basal metabolism to burn more endogenous or stored energy material, primarily triglycerides? And what we find in clinical literature today is that over 80% of individuals that set out on some type of recommended diet to make those changes, they fail. And there really are no excuses anymore. We live in a technological age, as evident by our present situation. We have all smartphones that we can download applications that allow us to calculate the calories in food. probably each and every one of you could calculate the calories in the food and drinks that you're consuming at this present moment. And you can know overall what is required of you to burn off later this evening. Yet, according to the Obesity Surgery Journal, 67% of North Americans are overweight or obese. And that's projected to hit 87% by 2030. That will contribute roughly to $1.4 trillion annually to simply control or mitigate the onset of comorbidities related to the impaired adipose tissue. So what are these solutions? Well, it comes down to a behavioral aspect, motivating the individual, treating specifically and directly the adipose tissue layer so that we can utilize more of the triglyceride material that has amassed or accumulated, so that we can have more effective exercise regimens and dietary protocols. And when we set out on this journey 9 years ago with Zerona, that was the goal. That was the mission, to develop a technology that could simply serve as the catalyst, if you will, a major motivating component, so that we have more successful individuals that are able to participate in dietary and exercise regimen. Now, a majority of technologies on the market prior to Zerona and medical intervention through pharmacological agents were utilizing the wrong pathways. Liposuction, for instance, viewed this tissue as an abnormality, an aberration, if you will, that it was something that could be excised or removed or damaged. Yet they didn't have that recognition of its endocrine function, its capability of releasing vital hormones. That pharmacological agents chose to introduce stimulants, which still have failed to receive or gain FDA approval today, simply because having an obese or overweight individual consume a stimulant that's already at a risk of heart disease or cardiovascular disease was not positioning them in the best possible light or health condition. And thus, we were at this standstill, this waiting period for technology to merge or integrate with standard practices of care regarding diet and exercise. So Zerona was born from the idea of developing a technology that could target adipocytes, target adipose tissue without inducing harm, without impairing the general biological function of this tissue. Because we understood that in a lean state, the tissue was viable. In a lean state, the tissue served an important endocrinological role to regulate insulin sensitivity, to help control fat breakdown, to regulate hunger. And so if we were to extract some of the tissue or damage some of the tissue, we could perhaps do more harm than truly good for that particular patient. So Zerona was developed with a unique therapeutic approach. Most individuals associate laser with some type of thermal event, a means of creating macroscopic energy or heat that could be observable at the macro level. If you're not familiar with laser, you can simply go to your local video store and rent a James Bond movie, and it seems like almost every movie there's a high-powered laser that is attempting to eliminate James Bond. A crude analogy, but it summarizes our perception of laser therapy. But laser therapy is divided into several groups. There are the thermal, high-powered lasers that we are commonly familiar with, and then there are the low-powered lasers. These work under a principle known as photochemistry. Photochemistry, its root word, when we break it down, photo is referring to photon, the very entity that makes light, and chemistry is referring to the chemical and biochemical nature of cells and tissue. So it's the utilization of light to impact or modulate biochemical and chemical reactions within the cell. This concept or idea is something that you all are quite familiar with. This is common with pharmacological agents. Pharmaceutical agents introduce molecular properties or components to achieve one thing, to alter or modulate biochemical and chemical reactions within the cell. This is commonly known as the agonist effect. If we want to solve a medical ailment, we introduce, let's say, a molecular component. That molecular component endures the digestive tract. It's absorbed into the circulatory system. with the sole purpose of now seeking out a specific receptor. The specificity allows it to ignore binding to other cell receptors, but to seek out and bind to a specific receptor. Once bound to that receptor, the drug changes its biology. It then sends a signal into the cell known as a secondary cascade. That then in turn alters that impaired cell's biological function, either suppressing a specific mechanism or activating a specific cascade. The overall goal is changing the biochemistry of that cell to yield a desired response. And it is that desired response that ultimately is going to provide the clinical benefit. Now, through the drug's mechanism, we don't feel or know that it's working. If we are suffering a headache or some type of impairment and we take, let's say, an over-the-counter pain suppressant, we don't feel or know that it's working. What we do perceive, however, is the resolution or benefits, the suppression of our pain. So that agonist effect achieves its overall outcome without the patient perceiving its binding to the receptor, its changing of the biochemistry. So now when we apply this to low-level laser therapy, we're able to yield or induce a clinical cascade without the patient feeling any macroscopic sensation, without altering the overall integrity of the cell. And that's photochemistry. It's a subtle overall discipline, modulating cells so that we can achieve a specific and desired response. How is that possible? How can we use light, which is the most abundant source on planet Earth, to affect the biochemistry of the living body? Well, in actuality, we actually possess photoreceptors. Now, we all understand the photoreceptors that are within our eyes that absorb specific wavelengths of light, exciting neurological tissue that then ultimately is interpreted by the brain, and then we are able or capable of perceiving color off of structures and certain components. But we also have photoreceptors in a majority of our other cells. In fact, one of the photoreceptors, cytochrome C oxidase, is positioned in the mitochondria. And the mitochondria is found in every single cell in the human body except for the red blood cell. So essentially, laser therapy has a photo target within every cell but the red blood cell. Now that's a different conversation because the red blood cell in and of itself is one gigantic photoreceptor. Hemoglobin absorbs a specific wavelength of about 650 nanometers, and ergo we see pulse oximeters using a very discrete and specific wavelength to measure oxygen binding or saturation on red blood cells. Different conversation for a different evening, but that is representative of photoreceptors within our body. The oxidase is positioned in the mitochondria. Interestingly, its location is essentially along the power plant of the mitochondria, that assembly line responsible for producing adenosine triphosphate. So what is adenosine triphosphate? Well, that is the most important biological catalyst in our body. It allows our muscles to contract. It drives a plethora of biochemical reactions within the cell, allowing them to go to completion. It is the essential entity of this living cell. It is equivalent to electricity powering my laptop, powering your room. Without it, this conference is not possible. Without it, our normal way of life is not possible. Same holds true for ATP. Without it, we are unable to have a living and thriving cell. And so by utilizing a very specific and discrete wavelength, we have capacity to stimulate cytochrome C oxidase and therefore alter or affect how the cell produces energy. And in turn, we have the ability to affect many, many different biochemical reactions depending on how we stimulate cytochrome C oxidase and how we stimulate ATP production. So understanding this basic principle that within our cells exists a photoreceptor, that this photoreceptor had very specific parameters like a drug binding to a receptor. We cannot introduce any molecular component and think that we're going to stimulate that receptor. It has to be specific. And there were, since its development in 1967 of laser therapy, there have been nearly 3,000 peer-reviewed publications. And so we could utilize this literature stemming from 1967 to present day to craft the overall parameters of Zerona so that we can be specific to the adipose of the fat cell, so that we could be specific in altering its overall biochemical function and its physiology. And so when you look at Zerona and the specific parameters of that device, you'll see a crisp, bright red line, and that is at 635 nanometers exactly. So think of that as our active ingredient. So any change in that color of light, changing it from 635 to 640, severely alters our stimulation or our ability to stimulate cytochrome C oxidase. It has that grade of specificity. And so that's why we utilize the wavelength that we do. And similar to a drug, we also have to adhere to the basic elements of energy, of dosage, if you will. If we have a particular size individual and we have a drug that we would like to introduce, we have to introduce the correct dosage. Because too little, we don't yield the clinical response. Too much, we could potentially have a toxic outcome. So it's known as a biphasic response. We have to deliver the correct dosage. Well, with laser therapy, if we deliver too high of an intensity of light, too much, we can actually damage the tissue. And that's really the clinical outcome for thermal lasers, delivering an incredible amount of energy that could overall heat the tissue and create an impairment of that tissue so that we can yield a specific response. But at the same time, if we deliver too little energy, then essentially we're just shining a flashlight on that. We're not giving enough energy to the tissue that could stimulate that overall chemical or biochemical cascade. So what we set out to do was to identify the specific parameters of laser therapy and how it could specifically affect adipocytes or fat cells. And what emerged were essentially 8 separate peer-reviewed publications, ranging from Plastic and Reconstructive Surgery Journal to Clinics in Plastic Surgery to textbooks such as Atlas of Liposuction. All of these studies, this collective information and data, was able to demonstrate that 635 and not 650, 635 and not 500, that was the wavelength to specifically stimulate cytochrome C oxidase and affect adipose tissue. Additionally, it was our output energy that we see today of 17.5 milliwatts. That's the output intensity, how much light we're emitting per second. That specific intensity was the important energy to deliver in order to affect or overall modulate the adipocyte or fat cell. And so those parameters allowed us to determine how we're capable of affecting the fat cell. And so when we look at the unique physiology or structure of the adipocyte, it is quite different from all other cells, is that we find that it has the ability to expand 1,000-fold in volume, 20-fold in diameter. Most cells do not have that capability to expand to tremendous volumes. To put this in proper perspective, if any of you have children, the toy cars that they perhaps play with, imagine expanding that toy car that can fit in your palm of your hand to the actual size car. That is representative of the fat cell's ability to expand based on the accumulation of the material. And so the fundamental goal really for diet and exercise is getting that fat outside of the cell. And that requires an extensive effort on the patient's part. They have to exercise to release thyroid-stimulating hormone, to release catecholamines such as epinephrine and norepinephrine to stimulate adipocyte receptors, beta-anergic and alpha-anergic receptors that then activate hormone-sensitive lipase that cleave triglycerides into fatty acids. And finally, after all that, that fat can be liberated from the cell so it can be utilized for energy production. And that's really going to be the culmination of several months of effort, of commitment. But what if we could go in with our photochemical mechanism, our specific wavelength, our specific energy, and force the liberation of specific fat cells? Fat cells perhaps across the abdomen, the waist, the flanks, the thighs, so that we could ultimately address not just from a cosmetic perspective, slimming one's waist, but also liberating that fat, which is essential for overall health, for driving down or reducing or mitigating the risk of cardiovascular disease. So with the parameters of Zerona identified, we now began to introduce that to adipocytes. And what we found was the immediate release or liberation of intracellular or stored triglyceride lipid droplets. What we found is that following stimulation with Zerona, stimulating cytochrome C oxidase, we began to create what were known as transitory pores within the cell's protective bilipid membrane, that protective outer barrier. Now, why is that important? Well, I briefly described how we need to release fat. Now, we have to activate what is known as lipolysis. That is the breakdown of triglycerides into free fatty acids for one thing, to actually get the fat outside of the cell. This is a very extensive process. One of the biggest inhibitors of lipolysis, breaking down triglycerides into free fatty acids, insulin. And we are now in a sugar culture, unfortunately. There are more sugar in our drinks and our food than ever before. There is an increase or upregulation of insulin, and that specifically deactivates the breakdown of triglycerides into free fatty acids. So what we had to do was bypass this complicated step. We had to be able to release fat from an area without activating thyroid stimulating hormone or without activating this complex cascade. More importantly, we had to release fat from a specific area. When we wake up in the morning and we say to ourselves, today I'm dieting, today I'm exercising, we can't tell the body where we would like the fat to come from. We can't tell it to take off the fat from our abdomen, but keep it on our thighs, please. Take the fat on our arms, but can you please keep it around my buttocks or my abdomen area? I would like to keep the fat there. Or I would like to burn the fat there. We can't dictate where the fat comes off. So normally, the motivating factor for most individuals for diet and exercise, one of the major factors is your doctor telling you have to diet and exercise, but the other is not being able to fit into your favorite pair of jeans, or not being able to achieve something cosmetically, fit into a dress or wear. That's really a major motivating factor. In fact, the majority of individuals do ignore what their doctor advises concerning their overall health when it comes to overweight or dietary components. It really comes down to them choosing to do something because they want to achieve a goal. But the problem is, if you want to fit into a pair of jeans and you're dieting and exercising, your body's not burning the fat from that one particular area. In fact, there are many genetic reasons why that's not quite possible. You could have ischemic tissue, lack of blood flow, hypoxic. That's going to prevent the necessary hormones from permeating that tissue and burning the fat from that one area. And so the fat may remain around your waist, but you may get thinner elsewhere. And so what ultimately happens? The individual becomes disheartened because the process is not specific. The process is not localized. And so the goals that they've established for themselves, they may begin to fail in those essential goals, and then abandon altogether the regimen that they've established for themselves, the overall goal that they've created. Enlarged fat cells is one of the major contributors to comorbidities that are preventable. Cardiovascular disease, type 2 diabetes, just a few. And so what we have to accomplish is treating that enlarged fat cell. But what we also have to do is recognize the individual goals for people, that they want to achieve cosmetic milestones. They want to go from a size 12 pants to a size 8. They want to buy the smaller wardrobe. That's a tangible accomplishment. Looking and feeling thinner in the mirror. These are tangible elements that continue to motivate. And if diet and exercise fails to reduce fat in one specific area, well, we continue on our trend. We continue towards 87% of individuals obese or overweight by 2030 because we continue the 80% or above 80% failure rate with diet and exercise. So what happens is now there's a void. There's a gap. There's cosmetic medicine in one hand, and then there's traditional medicine in the other. Traditional medicine is advocating lifestyle changes and fitness. And aesthetic medicine is advocating these invasive or aggressive procedures that are targeting the fat cell and treating as though the tissue has no biological importance. But what was Zerona's goal was to blend or meld the two aspects, treating the adipocytes in a responsible way, but in a manner that's specific to that patient, helping them achieve a cosmetic goal so that in 2 weeks, they've achieved the milestone that they could not achieve in 4 to 6 months through traditional means. So what does that do? It makes the decision process easier for that person. If we could wake up 2 weeks from now and fit into 3 or 4 sizes smaller, if we could wake up 4 weeks from now and fit into 5 or 6 sizes smaller, dramatic transformation of our body, then when we're faced with the decision of eating dessert or buying the venti Starbucks drink that has over 60 grams of sugar and that would really satisfy our daily sugar intake within a few sips, then we may make the right choices because we can say to ourselves, you know what? I achieved something. I'm fitting into a pant size that I couldn't fit into in the last 5 years, 6 years, 10 years. And it's easy to make the right decisions because you're not trying to achieve something. You're trying to maintain something. And that speaks to the motivation factor. When we look at the clinical studies that have assessed dietary intervention, it comes down to motivation. Most individuals, and there are several platforms that are quite effective, such as online blogging and these chat forums where individuals can communicate to each other and motivate each other. Keep going, keep going. But still, there are inherent flaws. Life tends to intervene, and getting online, if you're raising a family, if you're working, that's not an easy task. And so missing 2 days of chatting and motivating each other can manifest or cause a few weeks to go by. And then that ultimately is an abandonment in the overall process. And so Zerona, by liberating the fat in a matter of minutes, bypassing a complex biochemical cascade to release the fat naturally, what we're doing is we're circumnavigating months of work. And we're achieving it within a few minutes. We're achieving it within a few sessions of Zerona. And this allows us to liberate or release fat from a specific anatomical area so that, as I said earlier, we're blending cosmetic with medical. And what we do is by releasing that stored fatty material, what we leave behind are the deflated adipocytes. The adipocytes of several years past, before the child, before the job promotion, before medical school, before life's intervention and central consumption of our time, where we're forced to make choices of fast food and other things that are inappropriate. Before all of that, when the fat cell was lean, we're returning back to that state. The fat cell remains viable, it remains whole, it still participates in its most basic and fundamental biological role in the body, but it's now lean. It's back to a viable and beneficial state as determined by some of our studies looking at adiponectin levels, leptin, and cholesterol levels, as well as serum triglyceride levels. And so by releasing the fat, what we're giving now is the body an opportunity to utilize fat from that defined area. So once released, where does the fat go? And so the good thing about it, when we track the fatty material, when we monitor fasting lipid panels, we see that the process of fat utilization was analogous or similar to the remaining stages of lipolysis. So let me remind you of the remaining stages of lipolysis. This probably takes you back to your biochemical days in medical school or your healthcare training courses, so I do apologize in advance. So once lipolysis, we ultimately release from the fat cell free fatty acids. The free fatty acids are transported through the lymphatic channels, deposited into the circulatory system, where the free fatty acids are transported to heart tissue and muscle tissue, liver tissue, so that they can be further broken down into something known as acetyl-CoA. But the overall goal of lipolysis is to release the fat from the fat cell so that other aspects of tissue, so that other cells can utilize it for energy production, primarily muscle tissue. The most important process or step in that biochemical cascade is the very first, actually getting the fat outside of the cell, because that requires an energy investment. And one thing that we should know about our body, it's highly efficient. The body doesn't want to make energy if it has to use energy. So generally, if it's getting an abundant energy source from food, it suppresses that first step. But as we go on through our day, 70% of our day, we use fat as energy. So your body's forced to use fat, either through diet or from our cells. What Zerona does is by releasing an abundance of fat from one defined area, we're giving the body a rich energy source to utilize that even during basal metabolism, your resting metabolism. So as your heart's beating now, as your diaphragm is relaxing and contracting, as my mouth and jaw is relaxing and contracting, that's all requiring ATP. And where am I getting the ATP from? Well, a little bit of sugar, and a majority of it is derived from fat. But where is that fat coming from? Hence the problem. When I'm dieting and exercising, that fat could come from anywhere. My arms, my breast tissue, my love handles, my abdomen, my thighs. No specifics to where the fat comes from. But if I'm getting Zerona treatment, I know that it's coming from my love handles. So that the fat that's driving my most essential or basic biological function is coming from my love handles. So I get an overall slimming event in that defined anatomical area without altering my serum triglyceride or cholesterol levels. And we were able to show or document this by looking at fasting serum levels. After Zerona treatment, liberating that fat, there's no elevation in serum triglyceride levels. There's no elevation in cholesterol levels. In fact, we have a peer-reviewed publication that shows there's a statistically significant reduction in cholesterol levels, in triglyceride levels. How is that possible? How is that even a feasible outcome? Well, remember, your body has to use fat. So it's getting fat into the blood, whether you're doing Zerona or not. But it breaks it down to a safe form as a free fatty acid. Now, the reason why we observe high cholesterol with somebody that's overweight or obese is because we lose the biological function in adipocytes. That has actually been linked to hypercholesterolemia, non-familial hypercholesterolemia, as 80% of cholesterol is produced in our body. The hormones that our fat cells release are now altered or changed because of the hypertrophic state. So we see a rise in the prevalence of high cholesterol in overweight or obese individuals. And so by safely and effectively reducing the fat cell size of a specific and defined area, what we see is restoring a restitution in that essential biological function. And so we see changes in serum cholesterol and triglyceride levels at the very same time. So that's a lot of information to understand or comprehend, but let me just overall give you a basic summary of what I'm essentially describing. We have to utilize fat for basal metabolism. Where do we get it from? It's a random process depending on blood flow and genetic factors of the individual. What Zerona can do is specify a pocket of fat so that we can have a cosmetic effect but still preserve the overall biological function of the fat cell but actually restore its benefit by reducing its size. Now what we see is the manifestation of secondary benefits of that. Because that enlarged fat cell is quite deleterious to the body, and it's one of the major factors or contributors to cardiovascular disease and other comorbidities, by reducing the size of that fat cell safely and effectively, we see secondary benefits as well. And so how do we prove all of this besides the histological and in vitro analysis regarding Zerona and its overall mechanism? What we had to do was perform several placebo-controlled, randomized, double-blinded, multi-centered clinical trials. The very same clinical trials that pharmaceutical companies have to perform in order to demonstrate the effectiveness or safety of one of their drugs. And so in this study, we monitored various parameters, fasting lipid panels to see if our mechanism held true, that the fat was safely broken down before entering the blood system. We monitored circumferential loss, and then some subsequent studies, we monitored adiponectin levels and leptin and visfatin, all these other adiponectin adipokines to see if we had an ability to modulate the overall biochemical effects of the fat cell. So under the guidance of the FDA, we first performed a placebo-controlled, randomized, double-blind, multi-centered study to show or demonstrate the overall slimming or contouring of Zerona in 2 weeks. We treated patients that were overweight with a mean age of 55. We treated them for just 2 weeks. Every other day, Monday, Wednesday, Friday the first week, Monday, Wednesday, Friday the second week. They did not know which treatment they were getting, either treatment from a real laser or a sham or placebo laser. The doctor evaluating them did not know what treatment the patient was getting. In addition to those strict parameters, all subjects had to record in a daily dietary journal all calories consumed and any participation in physical activity. So if we saw a departure or deviation from the normal lifestyle, such as going from McDonald's or fast food to eating at something like Subway or sandwich shops or healthier choices, we had to excuse that individual from the study because they introduced a confounding variable in the study. We couldn't say with some certainty that the result they demonstrated was a result of Zerona or the changes in their lifestyle. Sadly, we also had to advocate some forms of alcoholism. It is sad, but true. If individuals admitted to us before the study that they consumed 3-4 glasses of wine at night to help them relax, we had to see in their daily dietary journals that they were still consuming 3 or 4 glasses of wine at night. If we saw a transition from wine to water, that's a confounding variable. We don't know the effects that alcohol deprivation would have on the basal metabolic rate, on hydration, as alcohol is a diuretic. And so we would have to have excused that individual from the study if they stopped consuming their alcohol. And so this strict parameter ensured that we are evaluating Zerona and really mitigating the risk of confounding variables. At the end of that clinical trial, under the guidance of the FDA, subjects receiving actual Zerona treatments in 6 total treatments in 2 weeks, treating their waist, hips, and thighs, lost 3.5 inches collectively off their waist, hips, and thighs without diet, without exercise, without hydration, without anything. When we compare that to the placebo group, the total combined loss across 3 areas was 0.68 inches. So the difference between the populations was statistically significant. Additionally, no adverse events were reported, and so the FDA issued the first ever FDA clearance for any form of medical intervention, whether it's pharmaceutical, surgical, or non-invasive, issued the very first FDA clearance for non-invasive or body contouring of the waist, hips, and thighs, because we were able to show, with no confounding variables, a circumferential reduction of the waist, the hips, and the thighs. Now, in addition, we had to record fasting lipid panels. We had to ensure or demonstrate to the FDA that at no point was there an elevation, whether it was transient or chronic, that there was no elevation in serum triglyceride or cholesterol levels. Specifically, we also had to look at low-density lipid proteins, high-density lipid proteins. We also had to do subfractioning, small particle and large particle, to show to the FDA that there was no alteration in serum chemistry. In fact, what we did show the FDA was that there was a statistically significant reduction. Individuals that had high cholesterol saw a reduction. Individuals that specifically had high LDL levels, low density lipid protein levels, saw a reduction. HDL levels, or high density lipid proteins, however, did not show a reduction. In fact, it maintained. There was no statistically significant change in HDL levels. So we actually improved the HDL to LDL ratio. And so overall, what this demonstrated was that the release of triglycerides from the fat cell following Zerona, they were being safely broken down prior to entering into the cardiovascular system, and hence no changes in serum chemistry. Now, how could we explain the benefit? How could we explain the reduction in cholesterol? It's actually quite simple. In 2010, a brilliant article was published, and the title says it all: Adipose Tissue as an Endocrine Organ. And there were several other articles that pursued that in 2006, in 2008, and 2010 was the latest, that showed that the fat cell releases hormones that can actually regulate cholesterol levels, that the fat cell releases hormones that could regulate glucose metabolism, and actually when it becomes enlarged results in insulin resistance, hence type 2 diabetes. But what studies showed is that the collapse of the fat cell, the reduced size, showed higher levels of adiponectin, which actually restored insulin sensitivity and reduced the risk of type 2 diabetes. Other hormones, such as visfatin, that actually had a beneficial effect on overall liver production, liver function, as well as muscle utilization of fat material. Other indications or factors of inflammation were changing. Reductions in C-reactive protein, reductions in ESR, increases in or reductions in leptin levels, increases in adiponectin levels based on a few of our studies. And so this was an indication that by working synergistically with the adipose tissue, not using aggressive force, not using aggressive energy, high-powered lasers, ultrasound, other aggressive means to destroy this tissue, we could responsibly affect its size, yield a cosmetic outcome, thus increasing satisfaction, motivation for that individual, but doing no harm. In fact, having an overall clinical benefit, a positive medical outcome, as we've seen with Zerona Canada, Dr. Gostik's, in some of the studies that he has performed in his exceptional research team, showing these changes in overall lipoma size and other serological benefits. And so what this was an indication of was that we could responsibly treat fat cells. We could yield a response that was specific or isolated to an anatomical area, thus motivating the individual in reinforcing the dietary programs that you recommend, that you suggest, but allowing for greater adherence, greater commitments based on the accomplishments that we can achieve with Zerona in a little time frame. So what we did from there is we built a platform that with the FDA clearance, with the placebo-controlled randomized double-blind study, with the 3 separate retrospective studies, one having a cohort of population size of 689 subjects, peer-reviewed, published in 2012 in Lasers in Surgery and Medicine. We've recently secured peer-reviewed publication this month. It will publish in Lasers in Surgery and Medicine. Again, another publication looking at 89 subjects, seeing in a physician-led study, no financial compensation, simply a study performed by an independent internal medicine physician, found that she could duplicate our FDA study and showed benefits from a serum chemistry perspective and overall benefits in patient satisfaction and compliance to diet and exercise based on their slimming event in 2 weeks. But what we have established was the platform, if you will. We partnered with entities like Zerona Canada reinforce, more importantly, improve the Zerona protocols. They have developed strategies and forms of intervention that now have improved the results 5-fold, 6-fold. They are able to achieve responses that took us 2 weeks in our FDA study. They can achieve that similar response after a single treatment by looking at very important parameters such as hydration, ensuring an adequate fluid level in the adipose tissue layer of the subdermal tissue, as it's referred to, looking at other aspects of the individual to elevate their ability to catabolize or break down the fat that they're liberating from an anatomical area. And so what that does is it transforms this technology even more, and it transitions it from a cosmetic perspective and more to a medical one, as we can yield greater responses, reinforce their motivation. We can have a greater impact on the overall integrity or functionality of the adipose tissue layers so that we can get a better or more meaningful change or transition in that person's basal metabolic rate, that person's endocrinological function, so that there is a more pronounced benefit, not just from a cosmetic perspective, but from a medical perspective. And that has been championed by Zerona Canada. And so with that, we have partnered with them to explore this technology because of their acumen that they've demonstrated, their exceptional skill set in data acquisition and organizing clinicians for clinical trials. We have partnered to explore in much greater detail the medical aspects. How are we affecting perhaps visceral adipose tissue, which is more strongly related to comorbidities and other conditions? How are we affecting visceral or intra-abdominal fat? What specific parameters of blood chemistry are we seeing regarding the adipokines? Are we changing leptin levels so that we're changing the way it responds to the hypothalamus? Are we changing the way leptin receptors are sensitive? These are all things that Zerona Canada has expressed interest in and has determined as a meaningful endeavor on their part acquiring new clinicians and partnering with them to explore this technology in greater detail. And so we have also broadened the claims with this technology as well. We're the only device and technology today that's actually FDA cleared to treat the upper arms. And that again followed a placebo-controlled, randomized, double-blinded, multi-center clinical trial. Now, how does that relate to a medical function, treating the arms? Well, what we find with the arms is that when we go to the gym, based on fibrotic tissue and really an ischemic quality of the tissue, it can be very difficult to exercise. And that, again, speaks to the motivation factor. If somebody wants more defined arms so they can wear sleeveless shirts, and that's really what makes them happy in life, doing things that they used to do at a younger age or at a different period in their life, they want to return back to that. So they set these goals again. I want defined arms so I can wear a sleeveless shirt. And when that's not accomplished in a reasonable or acceptable time frame, the same thing over and over again happens. They become disheartened. They abandon the regimen or protocol that they set for themselves. And that ultimately, again, deviates them or diverts them from the normal healthy lifestyle because they set a cosmetic goal. And so with the Zerona device having the ability to treat upper arms, it's another catalyst. It's another form of motivation so that we can ask the individual, what do you want to achieve in a single treatment in the regimen that we develop for you? And when they set the goals, it's usually quite simple. I want abs. I want to fit into a size 4. I want to fit into a size 6. And when we accomplish these goals, the satisfaction improves dramatically. The compliance to other protocols and programs improves dramatically. So what do we see today in Canada? What do we see that the overall goals that have been championed by Zerona Canada? What they have done, and proudly so, what they have done is they have actually shifted away from cosmetic medicine altogether. They're not partnering with plastic surgeons. They're not looking at partners or clinicians that see this as a quick fix. They're partnering with clinicians and medical professionals see this much more. An epidemic. They see. So the partners with Zerona Canada recognize that there's a population that has made a concerted effort, that has listened to their doctor for the better part of a decade, saying you need to diet and you need to exercise, but you continue to come to me 5 or 10 pounds heavier. And what we can provide is a technology that, as I said earlier, blends the cosmetic, achieving the goals or milestones, but responsibly treats enlarged fat cells so that somebody has high cholesterol and you recommend a statin's only as good as the diet and exercise change that they have in their lifestyle. If you prescribe a statin medication, but they continue to have an inappropriate behavior, inappropriate lifestyle, the statin's only going to be so effective at reducing the cholesterol levels. The statin's only going to have an effect on HMG co-reductase, and that's going to mitigate or reduce cholesterol production in the body. But if there are exogenous or dietary sources coming in, the drug is now combating not just the biochemistry, but the dietary and behavioral components. So what does a physician, a responsible physician, do or recommend when they prescribe a statin? You need to diet or exercise. But they now have a drug. The patient has a drug. And we are a drug culture. I have a drug that treats a symptom. I'm fine. Why do I need to diet and exercise? And that doesn't aid in the meta benefit. But what we can have now are clinicians that said, I've told you time and time again that you need to diet or exercise. Allow me to offer this treatment, treating your enlarged fat cells, providing you with this catalyst, this form of motivation, so that after a treatment, you could be down 3 or 4 inches. I can show you a reduction in 3 or 4 inches across your waist. And when we can achieve results in that little time frame, then it doesn't become a choice now for patients, as I stated earlier, of setting goals, unrealistic goals. It becomes now a maintenance issue. That, okay, I achieved something. I was able to lose 3 inches off my waist, my hips, my thighs, whatever area we target. I'm fitting better into my jeans. The fatty material is not overshadowing my waistline. It's not rolling over my waist, as it's crudely referred to as the muffin top. I don't have that. I don't see that. And so what it comes down to is that person more likely to do the right things to keep that muffin top from, again, reappearing, from ultimately transpiring once again? Of course. And we see that time and time again with our studies. We see that time and time again with the testimonials and the experiences that Zerona Canada has been able to acquire in treating thousands and thousands of patients. They have, as a researcher, as a biochemist, they are the ideal partner because they provide so much data and insight to the technology. In Canada, we're looking at, one, the treatment of lipomas. Most lipomas require some form of surgical intervention, which is simply a fatty layer, if you will, that's encapsulated by a fibrotic sheath. And so what we see is that it can cause discomfort, it can cause pain, and there's a tremendous cosmetic aspect to it, as it can be quite acute, localized, and it's a large protuberance from the tissue. And so we're treating lipomas in a study now. The study, Dr. Gosovic has treated lipomas the size of footballs and was able to completely resolve the lipoma. And the only other form to treat that successfully, from his words, is surgical intervention. And with surgery comes the inherent concerns of anesthesia, inherent concerns of infection, which leads to septic shock, and that can be quite deleterious to the system, even lethal. So we're trying to provide alternative means. So that is one study. But looking at, with no other forms of medical intervention today that can effectively alter fat cells and reduce their size, restore a beneficial function responsibly. There are no pharmaceutical agents. There are no medications. Research has shown that it's many, many years away from affecting fat cells' biochemical function responsibly. So we're looking at studies that monitor cholesterol levels. We're looking at studies that monitor adiponectin levels. So that's a major adipokine or hormone that's solely produced not by visceral fat, but subcutaneous fat. That's the fat that we can squeeze and move around underneath our skin, the fat that we truly load. So those studies speak to a more medical benefit of the technology. And what Zerona Canada can do is they've allocated a team and a resource for studies. So if there's a pursuit that a clinic wants to ultimately investigate or analyze, there's that conversation that we can always have to broaden our scientific exploration of the technology. And this is partners from not only from our company, Zerona Canada, but the manufacturer. There's a tremendous interest. There's an interest from the FDA's perspective. There's ongoing trials to treat obese patients. There's an ongoing trial to reduce hemoglobin A1C, which is a strong indicator for diabetes, and that's going to be a manifestation or a result of insulin resistance. So if we can have an effect on insulin sensitivity by affecting fat cells, in turn we should be able to see a reduction in hemoglobin C. And in fact, we've been able in pilot investigations to document that. But Zerona Canada has actually secured one of the covenant positions, one of the primary investigators for that study. Really, an ideal candidate is usually specific to a small group, a small percentage of the general population. That's not the case with Zerona. What we find is that our studies, whether they were the FDA studies or the retrospective studies, they've enrolled a broad and diverse and multifarious patient base. Individuals that represent several categories of BMI, normal weight, overweight, or obese. Individuals with different basal metabolic conditions, polycystic ovarian syndrome, hyperthyroidism, type 2, type 1 diabetes. Individuals have been successfully treated not only in the marketplace, but also under a clinical environment in our retrospective studies, and presently under the guidance of an FDA study, which is, of course, placebo-controlled, randomized, double-blind, multi-centered, enrolling individuals above a 30 BMI, specifically for type 2. So being said, when somebody does have a basal metabolic disorder, we can introduce Synthroid. If they have an issue with their thyroid hormone production or T3, T4, we can really introduce this exogenous or medical form to replenish or replace. But does that actually alter or affect the basal metabolic? And what we in certain subsets of the population, that's not the case. That polycystic ovarian syndrome, for instance, has a much higher incidence of overweight or obese individuals. And so we can apply this therapy without a strict or rigid inclusion criteria, because in the eyes of the FDA and the eyes of Canada, it's a non-significant risk platform. You cannot find any other treatment that's a non-significant risk technology. And that, again, is something that's documented in our FDA letters and our Health Canada documentation to show the safety. So what this does is we often look at these cosmetic procedures and say we're restricted to a specific population. And that's true. Most technologies can only treat the normal weight that has a small pocket of fat. Not going to make a dent or impact in the epidemic that's plaguing us. And it's not going to provide much motivation. So what we look at is a technology that enrolls a broader patient base. And the one partner throughout the world, as we represent the United States and over a dozen countries in Europe, the one entity, Zerona Canada, that has treated the most obese subjects and patients is them. And they can provide testimonials and data that shows the effect it has on that population that really has limited therapeutic intervention. I mean, lap band surgery, gastric bypass, these are viable options, but and I don't want to offend anybody in my terminology, but they are glorified diets, if you will. Once you have this medical intervention, you have to adhere to a very strict diet. Baby food for 6 weeks after the procedure, then blending your food for an additional 4 weeks. But the problem is individuals do not maintain that rigorous diet, and then they start to incorporate whole foods that can actually deteriorate the effectiveness of that overall procedure, and not to mention increase the likelihood of complications. And so again, those procedures provide an attempt to motivate, but the time frame to achieve the results is still dependent on the calorie intake. So with that being said, we have a diverse patient base, which is essential today, because in reality, most individuals that are candidates for liposuction today give us a decade, and they're not going to be candidates. We're going to see the population who are candidates slowly dwindle for liposuction because they're transforming or transitioning into the obese category, and now they have other medical complications that exclude them from surgical intervention. So we have to treat not just the normal weight, the overweight, but the obese clients more importantly. Now, what are the studies that we're looking at? We have partnerships and allies that within Health Canada chain that can formulate their own studies, independent studies. We can help document and capture that data, looking at a subset of patients, polycystic ovarian syndrome for one, individuals that suffer from basal metabolic disorders, that they see depleted basal metabolism, and thus biochemically they're at a disadvantage already. And the food choices that we see in modern society and Western cultures, that's not going to support or aid them in their success in maintaining that health beneficial weight. So we can look at specific population subsets in order to determine the effectiveness of intervention in that capacity. Hopefully that addressed your question. Would you need me to elaborate more on a specific topic? No problem. Of course. And I'm honored, and I just want to end the conversation by saying everything that I stated tonight is stemming from or derived from a peer-reviewed publication. And that's something that Tabitha in the front row can provide you. That's something that can be disseminated. That nothing tonight was something that you can't read in a medical journal publication that has been accepted by your peers in highly regarded journals. And so that's the most important thing that I can reiterate, that everything I mentioned tonight, whether it's the fasting lipid panel data, the investigations looking at some parameters of blood chemistry to the level 1 clinical trial, all peer-reviewed published. And that's something that is a true departure from a majority of other devices that claim to be body contouring, that claim things that are just not grounded in evidence-based medicine. And that's the most important thing. Evidence-based medicine reigns supreme for medical ethics. So with that being said, again, I would like to thank you for your time, and I truly look forward to speaking with all of you again.